Ancient brain surgery sounds impossible. You picture a modern operating room, bright lights, anesthesia, and highly trained surgeons. Now imagine the complete opposite. A sharp stone blade, no anesthesia, no painkillers, no understanding of bacteria, someone cutting into your skull while you're fully awake, and somehow, you survive. This wasn't a myth. It happened thousands of times. Most people assume a procedure like this could only end in unbearable pain, infection, and death. But the truth is far more surprising. In some ancient civilizations, patients survived brain surgery at rates that matched or even exceeded those of hospitals during the 1800s. Some people even underwent the procedure more than once and lived for years afterward. Somehow, surgeons working thousands of years before modern medicine were keeping more patients alive than doctors much closer to our own time. The procedure is called trepanation. It involved carefully cutting, drilling, or scraping a hole into the skull, and is the oldest surgery with direct archaeological evidence, dating back at least 7,000 years. Scientists know many patients survive because bone heals. Fresh surgical holes have sharp edges, but healed skulls develop smooth, rounded bone growth around the opening. Bioarchaeologist John Verano has studied thousands of trepan skulls from ancient Peru, and most show clear signs of healing. Survival wasn't rare. It was common. The evidence becomes even more astonishing when compared with modern history. In 2018, researchers compared ancient Peruvian trepanation with cranial surgeries performed during the American Civil War. Civil War surgeons had steel instruments but no understanding that bacteria caused infection. Roughly half of their patients died. Ancient Peruvian surgeons, during certain periods, achieved significantly higher survival rates. Despite having fewer tools, they were often more successful. Their techniques explain part of the mystery. Instead of chopping through bone, they slowly scraped away thin layers or gradually deepened a shallow groove. This reduced trauma and bleeding. They also consistently avoided major blood vessels and the large vein running along the center of the skull, showing an impressive understanding of human anatomy gained through generations of experience. Then there's the question of pain. There was no ether or modern anesthesia, but patients weren't necessarily left helpless. In the Andes, coca leaves were chewed for their mild numbing effect and their ability to reduce bleeding. Fermented drinks may have dulled awareness, while the pressure of the opened scalp itself could reduce sensation. Researchers also believe the ritual setting mattered. A patient surrounded by trusted members of their community, believing the procedure would help them, may have experienced pain very differently than someone terrified and restrained. None of these methods replaced anesthesia, but together, they may have been enough to keep patients still and alive. So what does this tell us? If people often labeled as primitive, using only stone tools and no knowledge of bacteria, could outperform surgeons during the American Civil War, what does primitive really mean? The real story isn't about luck. Long before hospitals or medical textbooks, ancient surgeons carefully observed what worked and what didn't. They refined their methods over generations, learned how to reduce bleeding and avoid fatal mistakes, managed pain with the resources they had, and passed their knowledge from one healer to the next. Their patients survived, healed, and sometimes even returned for additional procedures. One of history's oldest surgeries may also be one of its greatest forgotten medical achievements.